Think back to a time you were really frustrated with a health issue. It just wouldn't go away. You kept searching for answers, trying different things, just hoping something would finally click. That feeling, that wanting a real lasting solution, that's something many people dealing with intrauterine adhesions or IUAs know all too well.
Yeah, and for those maybe not familiar, IUAs, they're essentially scar tissue that forms inside the uterus, kind of causing the walls to stick together.
I can say that right.
And it often happens after some kind of procedure, maybe something that disrupts the uterine lining, like a DNC or certain surgeries. And this internal scarring, well, it can lead to some pretty significant problems for you.
Absolutely. Like we're talking about changes in your cycle, right? Sometimes lighter periods or even no periods at all.
That's right, or pelvic pain, and very sadly, real difficulties with fertility. That can mean infertility or even recurrent pregnancy loss.
And what's so, I think, disheartening is that even after you have surgery to remove these adhesions, they can just come back.
They really can. That recurrence, it's a major challenge. And that brings us right to the focus of our discussion today.
Yeah.
One of you actually shared a really interesting piece of research with us. It's a recent study looking into a new approach, a way to try and prevent these IUAs from reforming after they've been surgically removed.
So our mission today is really to dig into this study, understand what it found, what it might mean.
Exactly.
And the source we're looking at, it's a clinical trial published in a very respected journal, Fertility and Sterility.
Right.
And it's important to point out, this wasn't some small isolated thing. It involved multiple medical centers across 7 different countries.
Yeah, that multi-center approach, it definitely gives the findings more weight, makes them potentially more, generally applicable.
Okay, so let's talk about that recurrence problem. You said it's a major challenge after the standard surgery. What's that called again?
Hysteroscopic adhesiolysis, basically using a scope to go in and cut the adhesions.
Right. So how often do they actually come back?
Well, the authors of the study we're looking at, they point out that in severe cases, it can be really high. Like recurrence rates can be over 60%.
Wow, that's huge, more than half.
Yeah. And that often means patients need repeat surgeries. So the current ways we try to prevent this, they definitely have limitations.
Okay, let's unpack that a bit.
Yeah.
What are those current prevention strategies? What do doctors usually try now? And what are the downsides?
Sure. So the study mentions a few common things. Hormonal therapy, like estrogen, sometimes placing an IUD, an intrauterine device, or using special balloons inside the uterus to physically keep the walls apart while they heal. Sometimes barrier gels are used, or even grafts of human amniotic membrane.
Okay. Quite a few options, but you said they have limitations.
Yeah, none of them have really emerged as the definitive solution, especially when you're dealing with moderate to severe adhesions. Hormonal therapy, for instance, its effect is kind of time limited. IUDs and balloons, well, you need another procedure to take them out, right? And there's always a small risk of infection.
Okay.
Amniotic membrane, it's not always easy to get. And maybe most importantly, the researchers here highlight that for many of these strategies, there just isn't strong, solid evidence they work well in the really tough cases.
So, okay, that really sets the stage for this new approach they studied, Womed Leaf. Tell us about that. What is it? How's it supposed to work?
Right. So Womed Leaf, the paper describes it as a tri-block adhesion barrier degradable polymer film.
Okay, polymer film. So like a thin sheet of special plastic.
Kind of, yeah. Think of a very thin, specialized material. It's designed specifically to stop surfaces sticking together. So after the surgeon finishes removing the adhesions, doing the hysteroscopic adhesiolysis, this film is inserted. It comes folded up in a narrow inserter, actually quite similar to how an IUD is put in.
Oh, okay. So relatively simple insertion.
Seems like it. And once it's inside the uterus, it starts to absorb the fluid that's naturally present there, and it expands.
So it puffs up, creating a physical separation.
Exactly. That's the key. By expanding, the film gently pushes the uterine walls apart, keeping them from touching each other for about a week.
And that first week is critical for healing, I guess, or for scarring.
Precisely. It's that window where new scar tissue is most likely to form if those raw surfaces touch. So after about a week or so, this polymer film is designed to just degrade naturally through hydrolysis. basically breaking down with water.
And then what happens to it?
Then it's just spontaneously discharged from the body, passes out through the cervix, no removal needed.
Okay, that's interesting. No need for a second procedure.
Right. And it's worth mentioning, Womed Leaf already has European registration. It's approved there for preventing IUAs, both, primarily after a procedure and also for what we're focusing on preventing recurrence after treating existing adhesions.
Okay, that sounds really promising. Yeah. Now let's get into the study itself, this PREG2 trial. How did they actually set it up to test if Womed Leaf works?
Well, they designed a pretty rigorous study. As we said, multi-center, right? 16 centers across the 7 countries: France, Czech Republic, China, Spain, Belgium, Italy, Switzerland.
Wow, yeah, quite a spread.
Yeah, which helps make the results more, generalizable. And crucially, it was a randomized trial.
Meaning patients were assigned by chance.
Exactly. Patients were randomly assigned to either get the Womed Leaf film put in after their surgery or to the control group, which didn't get any additional treatment beyond the standard surgery.
Okay. And to avoid bias, I imagine they blinded it somehow.
Absolutely. It was double-blinded.
So neither the patients nor the doctors evaluating knew who got what.
Correct. The doctors doing the follow-up assessment, looking inside the uterus later on, they didn't know if the patient had received the film or not, and the patients didn't know either. That really helps keep the results objective.
Makes sense.
It was also controlled, obviously, comparing Womed Leaf directly against just the surgery alone. And one more thing, they stratified it.
Stratified. Meaning?
They made sure the groups were balanced based on how severe the adhesions were to start with. So you're comparing apples to apples, essentially. You don't accidentally have all the severe cases in one group.
Gotcha. And the study focused specifically on patients with moderate to severe IUAs, the ones most at risk for recurrence.
That's right. That was the target population, women undergoing surgery for existing moderate to severe adhesions.
Okay, really solid study design then. So the big question, what did they find? Did Womed Leaf actually work? How effective was it?
Well, the main thing they measured, the primary outcome, was the change in the American Fertility Society, or AFS IUA score.
Okay, that's like a standard grading system for how bad the adhesions are.
Exactly. It classifies the severity. They measured this score before the surgery, obviously, and then again using a second look hysteroscopy, usually a few weeks or months later.
A second look inside with the camera.
Right. And what they found was, yes, a significantly greater reduction in that AFS score in the group that got the Womed Leaf film compared to the control group.
How much greater?
The average score reduction was 5.2 points in the Womed Leaf group versus 4.2 points in the control group. And that difference, that extra point reduction, was statistically significant.
Statistically significant, meaning it's unlikely that difference just happened by random chance.
Precisely. The p-value was low, 0.0153, suggesting it's very likely a real effect of the treatment, the Womed Leaf film.
Okay, that sounds positive. Were there other ways they measured how well it worked?
Yes, definitely.
Yeah.
They also looked at something perhaps even more clinically relevant: the percentage of women who had no adhesions at all visible during that second look hysteroscopy.
A completely clear uterus.
Right. And that rate was significantly higher in the Womed Leaf group. It was 41% adhesion-free compared to only 24% in the control group.
Wow, okay, 41% versus 24%. That's almost double the rate of being completely clear.
It's a substantial difference, yeah. Suggests a much better chance of restoring normal uterine function without needing more surgery down the line.
Any other effectiveness measures?
They also calculated what they called a responder rate. They defined a responder as someone whose IUA status improved by at least 2 stages on that AFS scale, like going from severe down to mild or moderate down to none.
Okay, a significant improvement.
Right. And again, significantly higher in the Womed Leaf group. It was 51% responders compared to just 29% in the control group.
Again, a big difference,
Yeah.
almost double.
Yeah. And the odds ratios they calculated basically confirm this, showing patients in the Womed Leaf group had like 2.4 times the odds of being adhesion-free and 2.7 times the odds of being a responder compared to the control group.
So the effectiveness picture seems pretty strong then. Reduced severity, higher chance of being clear, higher chance of significant improvement.
That's what the data from this trial suggests, yes.
Okay, but what about the other side of the coin? Safety? Was it safe? Did patients tolerate it okay?
Yeah, absolutely critical question. And the findings here were also quite reassuring. The study reported absolutely no serious adverse events related to the device in either group.
Okay, that's good news.
And when they looked at mild adverse events, the number and the types reported were pretty similar between the group that got the film and the group that didn't.
Like what kind of mild events?
Well, for example, in the control group, you had some reports of fever or abdominal pain. In the Womed Leaf group, there were things like a couple of uterine perforations during the second look hysteroscopy, which the investigators didn't think were related to the film itself, more to the procedure.
Well,
Some cervical trauma, maybe some itching. But crucially, none of these mild events were considered by the researchers to be actually caused by the Womed Leaf device.
and the film itself, did it cause any problems just by being there? Did it degrade properly?
Good questions. They specifically looked for any residual polymer during that second look hysteroscopy, and they didn't find any in the Womed Leaf group, so it seems it did degrade and get discharged just as it was designed to.
Okay.
They also tracked parent-reported outcomes, things like pain levels after surgery,
Right.
any discomfort from vaginal discharge, and those reports were similar between the two groups.
So having the film inside didn't seem to cause extra pain or discomfort for the patients.
It doesn't appear so, based on this data, no. So overall, the safety and tolerability profile looked pretty good in this trial.
Okay. Now, you mentioned earlier that the other ways doctors try to prevent recurrence have drawbacks. How did the study authors kind of position Womed Leaf compared to those other methods?
They definitely discussed how Women Leaf might address some of those shortcomings. They pointed back to the limited duration of hormonal therapy, the need for removal with IUDs and balloons, the potential infection risk, the sometimes limited evidence for other methods, especially in these moderate to severe cases.
Right.
And they highlighted Women Leaf's advantages in that context. Ease of insertion, like an IUD, the spontaneous degradation, so no removal needed. And now, based on their PREG2 trial findings, pretty strong evidence for effectiveness, specifically in this higher risk group of women.
Makes sense. Now, no study is perfect. Every piece of research has its strengths and maybe some limitations. What did the authors themselves point out about the PREG2 trial?
Yeah, they were quite transparent about that. On the strengths side, they really emphasize the design. Multi-center, randomized, double-blinded controlled trial. That's generally considered the gold standard for clinical evidence.
Right. High quality design.
Exactly. And having independent randomization and blinding really helps minimize bias. Including all those different centers across different countries also boosts confidence that the results might apply more broadly.
Generalizability, yeah.
And they also noted that their main outcome measure, the AFS score reduction, is clinically very relevant because, well, the whole point of treating IUAs is to restore the uterine cavity, right, for function, for potential pregnancy.
Okay. And what about the limitations they acknowledged?
They did mention a slight imbalance in the numbers between the two groups. Slightly fewer patients ended up in the Womed Leaf group than the control group.
Why was that?
It seems it was due to sort of variations in recruitment speed between the different centers and the technical way the randomization blocks were set up. They also noted a very small number of patients, I think maybe 3, who were incorrectly randomized before their initial surgery, but they were careful to exclude those patients from the main effectiveness analysis.
Okay. Small numbers handled appropriately. Anything else?
Just that a small number of patients didn't end up having the planned second look hysteroscopy to assess the outcome.
Oh.
Why not? Well, interestingly, they pointed out that for several of those patients, the reason they didn't have the second look was because they had become pregnant in the meantime.
Oh. Well, that's actually a positive outcome, isn't it?
Yeah,
Especially for this patient group.
exactly. So while technically a limitation in terms of missing data for the primary outcome, it's certainly not a negative clinical finding for those individuals.
Right. So putting it all together then, what are the really key takeaways from this research? What are the potential implications here for people dealing with IUAs?
I think the bottom line is that this study provides pretty strong evidence suggesting Womed Leaf could be a genuinely effective and safe option for preventing IUAs from coming back in women who have moderate to severe disease and undergo surgery.
Yeah, the significant reduction in those adhesion scores, the higher rates of being completely clear, the better responder rates, it all points in that direction.
It really does. And the fact that it seems easy to insert, similar to putting it in IUD, that's a big practical plus.
And could this be used more widely, not just for recurrence, but maybe to prevent adhesions from forming in the first place after other procedures?
That's definitely something the study authors speculated about. They suggested, that these findings might be relevant for primary prevention too.
Like after which procedures?
They specifically mentioned things like D&C for miscarriage or after a hysteroscopic myomectomy surgery to remove fibroids from inside the uterus, procedures that are known to carry some risk of causing IUAs.
And those are pretty common procedures.
They are. So the authors suggest that having a simple, effective preventative tool like Womed Leaf could potentially have a really significant positive impact on women's health globally if it proves useful in those settings too.
So future research needed there, maybe?
Absolutely. They suggest future studies could explore its use after procedures related to pregnancy, maybe compare it head-to-head against some of the other existing preventative strategies as well.
Okay, so if we're summarizing our deep dive today, it really looks like this Womed Leaf film, this degradable polymer barrier, seems to significantly cut down the chances of intrauterine adhesions returning after surgery, especially in those moderate to severe cases. And importantly, it appears to be safe and well tolerated in this study.
That sums it up nicely, yeah. The data points towards a meaningful benefit, fewer adhesions, less severe adhesions compared to just surgery alone.
And for you, our listener, especially if this is something you or someone you care about has grappled with the frustration of IUAs, the worry about recurrence, this research, well, it offers a pretty significant piece of hope, doesn't it?
It really does.
It introduces a potential new tool, something that might lead to better outcomes, maybe fewer repeat surgeries. Definitely something worth knowing about, maybe discussing with your doctor if it feels relevant to your situation.
And this study, it really highlights that ongoing innovation in women's health. When you think about how much IUAs can impact fertility, quality of life, how might more effective prevention strategies like this one really change the long-term picture for people affected?
Yeah, it makes you wonder, doesn't it? What other common issues after gynecological surgery might benefit from similar thinking? Proactive, maybe biodegradable solutions designed to prevent problems before they start.
It's a really interesting thought. Definitely food for thought.
Absolutely. So we encourage you, explore this more if you're interested. Look up intrauterine adhesions, maybe the PREG trial itself. And as always, if you have experiences or questions sparked by our chat today, please share them. Your input really does help shape these deep dives.